Dr. Masikorir, KTN News.
Now, the 6th Maisha HIV and AIDS conference kicked off today with the theme being the last mile towards resilience and innovation. Speaking at the conference, the National AIDS Control Council chairperson Angeline Siparo said poor women and children bear the brunt of disruptions of livelihoods that have been occasioned by the pandemic. WHO country representative Dr. Rudy Ajas added that the Global AIDS Strategy 2021 is aimed at ensuring that by 2025, at least 34 million people living with HIV in the world have access to medicine, treatment and diagnostics.
The priority for Kenya includes illnesses such as tuberculosis, issues of other public health concerns.
We have this conference every 2 years. And what we look at is innovative work that's coming from research that can inform policy and programs. What do we need to change? We've been having AIDS in the world for the last 40 years. There are countries that have eliminated HIV, especially in mothers and in children. And so that's what we really want to move towards. And so the conference is looking at research across the world, but specifically Kenyan researchers. What do we need to do for the Kenyan epidemic? Because our goal is to end AIDS.
We continue to press on. Out of the 1.5 million, we have 1.2 who are on treatment. But definitely we are missing 300,000. And I really feel more so for children who are less than 14 years old, who don't have the voice, that we have to be the voice for them.
Recommitting to urgent action over the next 5 years, the member states agreed to the following. Firstly, to reduce the annual HIV infections to under 370,000 and annual AIDS-related deaths to under 250,000 by 2025, ending pediatric AIDS and eliminating all forms of HIV stigma and discrimination. Secondly, to achieve the 95-95-95 testing, treatment and viral suppression targets within all demographics and groups and geographic settings, including children and adolescents living with HIV.
Now to the conversation I'd earlier promised. Professor George Magoha, Education Cabinet Secretary, is set to receive a report tomorrow on the just concluded Form 1 selection exercise, an exercise that took about a month and has been dogged by a number of issues. Tonight, as more than 1 million students who sat for their KCPE examinations wait with bated breath for the results of this particular exercise, I want to speak to Mudheu Kasanga, who's the chairperson of the Kenya Private Schools Association, and Andiwa